I recently received a question from someone in my online community about why I recommend Dr. Mark Sundberg's intraverbal subtest. Intraverbals are a big part of teaching conversational skills, so this video is all about assessing and teaching this important communication skill. I'm Dr. Mary Barbera, autism mom, board-certified behavior analyst, and best-selling author. Each week, I share some of my tips on turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. Today, I'm sharing a small clip from a live Facebook question and answer session where I answered why intraverbals are so important and gave examples to help you get started today. Why am I recommending the intraverbal subtest when I'm not recommending tit-for-tat programming? And just to refresh anybody's mind, the intraverbal subtest is 8 groups. It is a supplement to the VB-MAP. It is in the intermediate course. Under assessment, I recommend my assessment. The intraverbal assessment, and the self-care checklist. I recommend all 3 of those be done. And I do want to tell you that even though we're not sitting down at a table for anything for Lucas for multiple years, like we are not doing mixed VB for many years, potentially a decade. Like we do not sit down and drill and everything. But we still are programming for tacts and intraverbals. For example, when he comes home from his day program, I ask him what work he did that day. Some days they don't have work and he does puzzles and other things like that. For a while, he was saying cylinders, and his one-to-one, thankfully, comes home with him for a few hours so I can look at her and say, did he do cylinders? And so with him, he was making errors. He was over answering cylinders because that's really the job name that he knew best. Knowing his history, I'm like, that's a tacting problem. We need pictures of all the jobs and all the materials for the jobs, because part of his goal there is to request materials, request when he's out of a job. So if he's doing stickers on cylinders and he runs out of stickers, he needs to know the whole name of the job is called cylinders, but he also needs to know the parts of the job are cylinders and stickers, so that when he's running out of stickers, he can say, Ashley, I need stickers. Then when he comes home and I say, what did you work on today? Or where did you go with Ashley? Or any of those questions require an intraverbal response. We are still teaching him tacts, and we are still teaching him intraverbals. And for my one client, Alex, he's not in many videos. He's in the I want to go to Outback Steakhouse video. I worked with him from 6th grade until he was 21. And he used to work at the bakery at Weiss, and it was little muffins were like 4 across and 6 down or something like that. That was the deal. And so we would teach him intraverbals, like without the muffins, not at the bakery. We'd say, okay, for little muffins, how many across, how many down? 4 across, 6 down. And then what about the big muffins? Okay, 4 across, 4 down, or 3 across, 4 down. So there's always intraverbals as part of communication. And Lucas actually likes to do intraverbal webbing. I mean, we don't sit down and time and click. We're like walking in the park, or the other day, Lucas, what color is my husband said, Lucas, what color is your shirt? He's like, purple. And he's like, who else is purple? He's like, Barney. And he got a big smile on his face. So we are doing little webs throughout the day when we're on a walk, or, oh, what's in the sky, and that sort of thing. So it is much different programming. From the time the child is 1 to 5 or 6 or 8, we want to turn up the burners. We want to get the child as high functioning as possible. One of my past clients is going to college next week. We want to get them wherever the highest functioning, highest independence level is. But for kids at this moderate severe level, they're older children, they're teens, they're adults. It's not that I want you to give up hope, but I do want you to think about what we should do now to give that child the best life, to give his family the best life, to not be completely stressed every step of the way. Kind of shift your hope and shift your focus to be, my goal is be as independent as possible, as safe as possible, and as happy as possible. That doesn't revolve around 3 tacts and 2 features and 2 functions. Yes, he's at a job. His goal is to request more supplies. Yes, we can teach him the names, but he needs pictures. He needs little drilling to learn the names of new jobs, to learn the names of new people, to learn the names of new parts. I hope you enjoyed this short snippet. Wherever you're watching this, I'd love it if you would leave me a comment, give me a thumbs up, share this video with others who may benefit. And for more information, you can attend a free online workshop at marybarbera.com/workshop. And I'll see you right here next week.